I want to be a CRNA. I've wanted to be a nurse anesthetist since 18 years ago. As a respiratory therapist, I was working in the ICU, and I decided that seemed like something I was really into. So decided to enroll in the program and finally kind of pursue my dream. They have a lot of labs for us, like difficult airway labs, difficult IV access labs, and time to kind of practice skills in the classroom before we then go and do them in the OR. But they get us a lot of OR time in a lot of different settings. Nice to have a very varied experience. By allowing us to have those experiences, we're able to graduate and be prepared to walk into an OR. My classmates and I are really, really close. You get to know each other really well. You depend on each other, you study together, and those relationships have been integral to getting me where I am today. And our instructors are awesome. They want us to be successful, and they are willing to put the time in to kind of get us there. Going back to school was always a dream, and I've had a 20-year career already. Being able to do a distance program like this and be here allows me to be at home with my family every day, and it's been great to have that opportunity.
My main role is in Director of Clinical Education, in that I am responsible for the placements of our students at each of our 4 cohort geographic sites. We like to see students be challenged in clinical settings so that they understand pre-anesthetic assessment. They have the knowledge of anesthesia then to plan an anesthetic plan and carry out that plan, which may mean advanced skill sets like putting in central lines, putting in arterial lines, doing difficult airway management. And then they also get post-operative experiences. It's very satisfying to see the growth that a student makes throughout the program, and then to know that I feel confident that if I had my family member or if it was me, that's who I would want there. That's who I've trained. I feel confident in their skills. It's important that we can fill these positions so that populations in rural areas have access to care close to home. You're a critical part of the community, and it's very satisfying to take care of people in your community.
I've worked in healthcare in this area for several years, both as a nurse and as a nursing assistant. So I always kind of kept my finger on the pulse of, healthcare in this area, taking care of people here. And this really was the best of both worlds in terms of meeting that desire to want to go into anesthesia, but also being able to serve people in the community that I'm from. And so I would say that that was a huge driving factor for me. And I think anesthesia provides a really unique opportunity to connect with people in very vulnerable moments of their lives. And that's something I really feel passionate about as a whole. Be attentive to that. Be attentive to the fact that people are entrusting their well-being to you. But we have a unique opportunity to be conduits of peace to those patients that we get to interact with, but also a way to relieve suffering and to help them in that moment. I consider this work that we get to do to be one of the best blessings of my life.
I am the Director of Southwest Operations, so I will be involved with day-to-day operations for both of the cohorts in the Southwest area, so that's Roanoke and Abingdon. I teach a roles course. I'm also involved in the doctoral projects, and we'll be moving more into some of the basic sciences such as patho and pharmacology in the spring. They'll graduate with a DNAP, a Doctor of Nurse Anesthesia practice, which will give them the ability to sit for boards, so they'll be certified. At that point, they'll be able to work in any setting. CRNAs work in pain clinics, we work in ambulatory surgery centers, hospitals, is the gamut. We serve to do complex trauma down to labor and delivery for epidurals, spinals. So being able to train them at the Higher Ed Center in Roanoke, we are able to take individuals who work in the hospitals in the area, train them, and they're able to take those positions. It helps not only the student themselves, but it helps their families, and it helps the community.